Good morning, everybody. I'm Dr. John Willardson, and we're here today in beautiful Newport Beach, and I'm here with our manager, CFO, and the guy of many, many talents, Memo Hea.
Doctor, thank you. I'm glad to be here.
Glad you're here today with us, Memo, and we're grateful for our YouTube followers and our, those that are creating this community. We're developing a community to help patients really get a grasp on what it means when they're having their mouths reconstructed. Lots of advertisements out there right now for dental implants. The dental implant is just a minor part of the entire process. So we're here to take patients through the process to help everybody, even those who that don't need this type of work, understand and get a deep dive into the process, because it is such a process. We've had some requests for more surgical videos. I'm a little on the fence about that because for me, surgical videos are intriguing. Surgery is something I do every day. So to me, the human body is a remarkable organism. Again, I've said it 1,000 times. I'm always amazed at how it heals itself. We put foreign objects, foreign bodies into the body, and the body receives them. If all of the techniques and these standards are maintained at a high level, and both from surgical technique, from drilling speeds, from bone elasticity, there's so many factors. Removal of infection and debridement of granulation tissue or infected tissue. All of these factors play into the successes that we have here at Trust Implants and any other practice who's successfully running an implant center. These are all key factors, and the dental implant is just such a small part of that process. So oftentimes, we'll get calls, get a call, and how much is a dental implant? Well, it's kind of a broad question, because what area of the mouth are we talking about? How many teeth are we talking about? Our goal here is to restore the normal natural function of the patient's mouth. And that gets into the aesthetics. So if we look at, first, let me go to my photos here. So, and these photos were taken from a well-renowned dentist, Dr. Frank Spear. And here we are looking at ideal proportions. And ideal proportions of gum tissue, of the length of the tooth, of the width of the tooth, of the height of the papilla, of the height of the lip line when this is at smiling, or the height of the papilla at rest. So there's a lot of variables that we have to consider when, here we're taking, this is an ideal situation. This is a situation where the patient's teeth are untouched. There's no crowns, there's no veneers, there's no fillings. These are what we call virgin teeth. They've never been touched. And so Dr. Spear has created basically a guideline as to what are ideals. And, in this picture, what are we, the amount of papilla, which is the amount of gum tissue that hangs between each tooth, what's the ideal range for that amount of tissue? 5 to 6 millimeters. So the length of tooth beyond the papilla is actually 5 to 6 millimeters. That's how much tooth display we should be seeing. And these are all just guidelines. Every patient is different. And so when we look at, the 8 factors that determine an aesthetic or a beautiful smile, and the curve of Spee, when we look at how the teeth curve, and if this curve was off, if it was canted or if it was off in any way, even, non-dentists, or when you look at that patient's smile, immediately you notice something's off. Something just doesn't look right. And so it's our job as dentists to make sure that we follow these principles so that aesthetically it looks beautiful in the end. And so these are all guidelines that we use in order to establish a more functional aesthetic end result. Getting into, different, here we've got a situation where, and there are no straight lines in the body. In reality, there is no perfectly straight line. So just the different angulations and different guidelines. Unfortunately, Dr. Spear spent the time to develop these guidelines. This is what we call the height of contour. So the length of the tooth in relation to the gum tissue or the papilla, and this can vary from one patient to another. But this again gives us a guideline as to what are the ideals in an ideal situation. Here we have the ideal length of tooth and width. So about 75% of the tooth, the width is about 75% of the length. So, and we call these golden proportions. So the proportions that we see here are, again, ideal. They are the golden proportions, and they are what give a beautiful smile, which is our goal. That is our end goal, is to give the patient the most aesthetic, beautiful smile possible. When we get into, and I have a lot of patients that sometimes get confused about overbite and overjet. So overbite is when your teeth are together and you have 2 millimeters of overbite and 2 millimeters of overjet that doesn't restrict, meaning when you move your jaw laterally or move it to the side or forward, that they're not running up against each other, or you have what's called canine guidance. So the canines, the fangs or your canines, are what kind of guide and lift and protect the incisors, your front teeth. So that protection is when somebody has good canine guidance and their front teeth 7, 8, and 9 are protected, unless they use it as a tool, opening bottles and stuff, those teeth are protected in reality for life, other than for some form of trauma, because the canines, and that's how God created us. He has the canines play a very critical role. It's the cornerstone of the mouth, and it also is what allows the protection of the anterior front teeth. And so I show this only because this is an ideal situation. These patients have all of their teeth. They have no veneers. They have no restorations. This is an ideal world. Of course, in our world, we do not deal with the ideal.
Doctor, we have a question.
Yeah.
Is the papilla decided in the name of pure aesthetics or also functionality?
Oh, great question. So papilla. So let's look at the papilla. Let me see which photo would be best for that. All right. So here we have, and again, this is giving the golden proportion of your central incisors, your 2 front teeth, teeth numbers 8 and 9. But notice the papilla. The papilla is also both at the lateral position, so at number 7 and 10, and also right in the midline, which is 8 and 9. That papilla is in an ideal position and length. And yes, it does protect the teeth because it minimizes food impaction. And food impaction, if you imagine if that papilla was not there. And so therefore food would constantly, well, for example, I have a diastema. So my two front teeth, they used to touch. My two front teeth used to touch. They had my entire life until I did Invisalign. After I did Invisalign, it moved my natural teeth, and I'm a very non-compliant patient. So, but getting into the Invisalign topic, my opinion, strictly my opinion, I feel that taking trays on and off and not having that rigid fixation, whereas with braces, if you have actual braces that are bonded to your teeth and they're wired, and you go to your orthodontist and they move those teeth, and that wire is held in position. You cannot take it out. You can't remove it. Only orthodontists can, of course. Whereas with Invisalign, or these, what's becoming so in vogue is these trays, and having these trays to move teeth, but you take them out at night and you put them back in, or you leave them in at night, but you take them out. Even just that, removing the tray in and out, allows the bone to kind of relapse or go back to the way, or the teeth and bone to go back to the way that it was. And so I feel like that the retention is really, really important. Again, a few live streams ago, we talked about sigma. So 1 sigma is 3 months. So in order for the bone to remodel, and what that means is in order for the bone to organize itself to the point to where it can support those teeth to where they're not going to move, you have to keep them in solid retention for a minimum of 3 months. Otherwise, you are, if the patient is non-compliant like myself, and you're taking trays in and out, I've probably moved through the trays way too fast because I'm impatient that way. But in the end, I developed this gap or diastema, and so now I need to consider just regular braces because of the fact that for me, because of maybe ADD or who knows what, OCD, I was not compliant with the trays. So anyways, digress. Papilla is very important. The gum tissue that's in between each tooth is very important. It protects the tooth from debris collecting there. Of course, you have to brush, you have to floss, you've got to maintain keep your mouth clean. But the papilla plays an important role in the maintenance and hygiene and maintaining the teeth, but also the aesthetics. I mean, a perfectly scalloped papilla and scalloped gum tissue looks so great. Teeth are really beautiful. They are a beautiful smile is actually, people will look at your eyes like we talked about, but they immediately turn to your teeth as soon as they look you in the eyes. So, and unfortunately, you're judged by your teeth as well. So, all of these things play a role in aesthetics and also in the way that you feel about yourself. I mean, it plays a big role in that. So the papilla, yes, is a very, very important piece. And as we get older, as we age, we lose bone and we lose papilla because the papilla is supported by bone. So as soon as the bone starts to pull away, the papilla starts to follow with it. So the papilla is very, very important. So now we've got situations where, so that kind of demonstrates an ideal aesthetic for natural teeth, correct? Now, if we look at somebody who has lost their teeth, now the papilla is gone, bone is gone, teeth are gone. So many factors are now not that we just don't have anymore. So this patient, and I've shown this before, I showed this last week, but this patient ended up over, I believe it was a Western Dental, and they put implants in. I had to remove the majority of these implants because, one, diameter, position, there's a lot of factors that played into the rationale as to why I removed them. And also the implants are exposed. You can see the titanium is exposed here, which you don't want. And so the reason I show this photo is we're trying to take a situation like this, and we're trying to create an aesthetic situation of ideal. So we have to understand and manage expectations and know that dental implants are great. They're wonderful. They are an anchor to support a prosthesis or teeth that will function and work just like natural teeth, with a few exceptions. So in order to take a patient from this situation where she's lost all of her upper natural teeth and give her something that looks like this is, I mean, you really can't put a price tag on it. It's very, we're replacing aesthetics, we're replacing function, where you're affecting her digestion. We are giving her back so much because of what she has lost. So, all right. So now let's get in. Here's after photo, and you can see, and she's a younger lady. So having lost these teeth was a big deal, but you can see now having them restored gives her back that confidence that she had lost. And so now let's look at the prosthesis itself and the teeth that were, so here's the bridge that we had put in. And we're having to use artificial materials in order to give the patient back what she's lost. We have papilla here, but it's not tissue. That's pink porcelain. And we have, the teeth look beautiful. The dimensions are perfect. The aesthetics are nice. But at the end of the day, she has lost all of her teeth, and now she has implants that are going to be replacing those. So the functionality here is very important, how they touch and how they articulate, so that things will last her for the rest of her life. And so, we want to give patients back the ideal. This is what we're after. But when we've lost the teeth, we end up with situations where we have a little bit of a compromise. So here's another case where patient's lost all of her teeth, but when she smiles, you can't tell that they're not her teeth. This is all cheeks retracted and you can see everything inside, but aesthetically, very nice end result. And more importantly, she's not wearing a denture anymore, because if she didn't have this upper bridge, she would be wearing a denture that comes in and out at night. So what does it take? All of the steps to get to this point. Well, first of all, the patient had lost her teeth, and if I look at a case like this one here, lots of decay and neglect, and over time things just falling apart, and on the upper picture, of course. So all of this has to be dealt with, and we want it to, like the photos I showed before, we want it to mimic nature. We want it to look and feel as natural as possible, given the situation. And the situation is such that we've got to restore this with artificial materials. So whether it's crowns, implants, a full arch implant prosthesis, it's, we want to try to restore the ideal golden proportions with artificial materials. And in this case, I feel like we did just that. I mean, the patient was very happy, confidence is restored, his ability to chew and to eat is restored, and he's able to move on and have feel normal again. So,
Doctor, question.
Yeah.
Are you fully in control of fabricating the smile? Where is the laboratory? These are beautiful smiles.
Yeah, so that's, again, great question. So, like, if we were to look at, if we look at this case here, I think we can kind of see, well, let's just look here, because lips are retracted. So, yes, I'm in full control of the aesthetic outcome because I personally dictate where the teeth need to go. And then between the patient and I, we choose the color. I tend to kind of lean towards a lighter shade if you're going to go through all this. And if we're rebuilding the whole mouth, we have control over the color. We're not trying to match one tooth that's dark with everything else. So, by doing a reconstruction like this, we have control over the aesthetics so that in the end, we can give the patient a shade that looks beautiful and also the layout of the teeth and reestablishing those golden proportions and giving the papilla where it should be, even though it's porcelain, and having a situation where the patient, it resembles what was lost. And at the end of the day, that's what matters most. So that we can't restore it because it's gone, but we can restore it with materials that will feel and act and function like it was prior to losing the teeth. However, there is nothing like our own natural teeth. Our own natural teeth have the periodontal ligament, which acts like a shock absorber. There's a lot of small variables that are lost in losing teeth, but sometimes patients lose their teeth and there's just no other option. There's no other choice. So, all right. So, oftentimes we'll see cases that come in that look like this, where this was done at a different office. This was a denture, so a full upper denture that was screwed down on 11 implants, and the patient there's no way to clean this. So, and again, the only reason I show this is because materials matter. Obviously, there's no care, there's no thought about golden proportions where the papilla should be, even though it's in artificial materials. All of these things play into the aesthetic outcome of the case. And so, the doctor has to be able to understand these principles in order to apply them to the case so that when the case is done, they've achieved the most ideal aesthetics and function possible, given the fact that the patient has now lost his teeth. And we're utilizing dental implants to support the bridge or the prosthesis that is being utilized for the replacement of those teeth. And so, sometimes we'll have patients who come in and they've lost gum tissue. So right here, we've got a lot of recession. And it's not uncommon to have, as we get older, for the gum tissue to start to recede and pull away from the tooth. And you can see it, same thing up on top here. And so by reconstructing that gum tissue and kind of rebuilding everything, we're able, and here you can see, we grew about 5 millimeters of gum tissue around these teeth in order to, that tissue is so important. It's really important because it helps protect the tooth. The dentin, which is right here, is very soft and more susceptible to decay. So once it is exposed, that area is much more susceptible to bacteria and decay and the chance of possibly losing the tooth. So this is just a case of doing soft tissue grafting and then crowning the teeth that needed to be crowned. But you can see the difference. And the long-term effect of the picture on the right is we just bought him a good 15, 20 years maintaining it, probably more actually, I'd say, maintaining his teeth because he elected to have this procedure done to save his teeth. And in reality, there's no way to put a price tag on your own natural teeth. Implants are great, but at the end of the day, our own natural teeth are really what are so much better. So, lots of different styles and different types of pictures. Reconstructing a mouth, you have to look again at the smile line, and if there's any canting, if there's anything that's not totally straight, it's going to stand out like a sore thumb. And so if you're going to go through this process, make sure that, you know, the doctor that you go with can show you cases that are, you know, so you can kind of see if they have the same level of standard and understand the golden proportions and are able to deliver on that. Because, you know, once you go through this, you want it to be something that looks and feels very natural. This case, she did have a lower fixed. She had some implants that were done somewhere else. We had to bury one of them because it was in a position that was super close to the two implants were very close. So, but you know, we're able to restore the golden proportions, the aesthetics, the occlusion, the bite, the way the teeth meet together, and fix her mouth, because she had actually been to multiple doctors and was having a hard time finding somebody to restore and fix her case. All right, so which leads me to, you know, some of the there's a lot of corporate dental centers out there, and if we talk about that for a minute. So right now you've got the private practice. You have a doctor like myself who's set up shop and is putting his heart and soul into that practice. And then you have a lot of venture capital money that are coming in and buying up practices and kind of coming in and starting dental groups where they have large offices. But for example, in situations where you'll see these logos, you'll see some of these practices on the, like right next to a Starbucks or somewhere, and it's called, you know, Dentistry of Costa Mesa or whatever. You know, they don't really give the name of the brand, and in this case it's Pacific Dental, but these are corporate centers that are owned by a corporation. The doctor may own a small percentage of the practice, but at the end of the day, it's a revolving door of doctors. So the reason I bring this up is because the doctor managing the case just works for them. He doesn't have an interest in the office, so he's going to do whatever they tell him to do, because at the end of the day, for him and for the practice, it's all about money. And so that's how you end up in situations like this where, you know, patient spends $100,000 on implants, but the patient doesn't know any better, ends up in a Western dental type of a situation, and now all of a sudden years and years and years and years have gone by, and no one has controlled her case. And by the time she got to me, she had been in this denture for 11 years that was fixed, that was screwed down onto implants. So if you can imagine, the palate or the roof of the mouth was covered, and then she had, I think, 4 or 6 implants that were holding this in place. And so the food, the debris, the bacteria that was underneath here was tremendous. There was a lot of debris because she couldn't clean it. She had no way to clean it other than trying to get a water pick underneath there. So at the end of the day, we took it all out, restored her whole mouth, and she did have, like I said, she had implants, but they just weren't restored. They went unrestored. And she was having a hard time finding somebody to fix her mouth. She found somebody to place the implants, but she could not find someone to restore them and to get her mouth back into position to where she could smile again. And so I do have her before and after photo here somewhere, and I'd have to find it, and I don't have it on me right now. I'll show it next time. So, you know, there's so much to consider when considering these types of cases, when doing these types of cases. For doctors who are doing these types of cases, it's not just a matter of an all-on-4 and putting in 4 implants and doing, really fast overnight prosthetics and putting the implants in and the next day putting the final set of teeth on. Every patient has to be treated individually. Every patient has to, every tooth that's pulled has to be treated individually. Every implant that's placed has to be treated individually, and understand the torque values and understand how soon the case can be loaded so that, at the end of the day, the patient has something and the investment that they've made is one that they can count on. And so, there's so many reasons to really consider the, who does the case and doing your homework, because this is a common problem. If we look at the number of patients who are losing teeth, missing teeth, wearing dentures, wearing partials, wearing bridges, and are just, going to their corporate dental center and just getting their cleanings done, and they're not being recommended, you need to fix this problem, fix your mouth, get it done, get it taken care of so that the problem can be behind you. Because if you just let it go, let's say you're missing one tooth, and again, I've said this 1,000 times, but then you're missing another tooth and then another tooth. Eventually, the breakdown is such that it really starts to affect every aspect of your life, and especially in your digestion and your ability to chew and to eat. And then more, as important, your confidence is just out the window. This is a patient who was literally in that situation. She had come to me, she's a pretty lady, but, after I fixed her teeth, her life completely changed. And again, I've showed many, many different cases of patients whose lives have literally been transformed within a few months because they took that initiative to get their mouth fixed. And fixing it it's a science. It's not a haphazard situation where you give every single patient the same thing and just do that over and over and over and over again. There's got to be some thought around, who is this person? What exactly is it that they want? And how am I going to achieve that? I have to consider that on every single case. And so as a result, I'm able to, to really custom tailor each case so that in the end, I sleep at night. I know that I've done the very best job possible, and we've replaced and restored all of their natural teeth. And losing your teeth is a big deal. It's in today's world, people just don't accept dentures. They're not going to accept a piece of plastic to do the work of chewing and eating and smiling and giving you self-confidence. A denture just does not do that. It only functions at about 10% of normal, natural function. And so it's important that, that you choose wisely the doctor to do your case. So if you have questions regarding this, we are here to support. We are a forum, a discussion forum that provides information. We've done so many of these cases, every type of case you can imagine. You've got cases that are fixed, cases that are removable, so you have implants but the teeth come in and out, which I haven't done a removable prosthetic in probably 20 years. I only did one because I was a resident and we had to do a few of them. If you're going to go through the process and the pain and not pain, but the process of having implants, you might as well get a fixed prosthesis, one that stays in and you don't have to take it out. So you'll see ads on mini implants. You'll see ads on teeth in a day, teeth in an hour, and those are clickbait ads that are at the end of the day, this is an investment. This is one of the best investments you can make for yourself, to gain the level of confidence that, for example, this patient gained in a matter of just a few months. You cannot put a price tag on that. It's a valuable thing, and it is possible to get done. It's not an impossible task. Here at Trust Implants, we find a solution for 90% of the patients to make sure that they get this done. And we do it at the very highest level possible. I could go on and on and on about this, but there is tremendous value in doing these cases and doing them correctly, and just understanding the value of having your mouth restored. There's a lot of, we're happy to have you talk to patients who've been through the process that can help you and guide you. We actually have a concierge, Robin, who will help you through the process, because she herself has been through the process and can really put your mind at ease and know that in the end, the money that you spend on restoring your mouth and restoring your life is so worth it. And we have different options for financing, different ways that we can help patients to achieve and accomplish these goals. And again, like I say, if I could just put it in your mouth for one day, you would come running back here doing it, because it truly does make that big of a difference. So, if you are in need of dental implants, or if your mouth is having a hard time, if you're losing teeth, if you're missing teeth, if you have periodontal disease, if you're just losing one tooth, get it fixed. Restore that one tooth, because there's a domino effect here. And by restoring just that one tooth, you're going to save losing other teeth. So I hope that this video helps. I hope that our content helps. There's a lot of content on YouTube. There's a lot of content on our channel. Subscribe, follow us, ask questions, give us suggestions on things that you want to hear and know about, whether it's grafting, whether it's implant surgery. This week I got three comments, or four, just talking about implant surgery, which we talked about that last time, but I only talked about a minutia, a very small fraction of the details that go into the placement of one implant. And of course, I get some hate comments as well, which, that's, the haters are my motivators. So that's okay too. We have a very high level of success here, and we have a good environment for patients who are so afraid to go through this process. And we get it, because it is a process, and it is scary, and it is, just the thought of, like I said, the thought of me losing my teeth just, makes me cringe. But sometimes it's necessary. Sometimes patients there is no other choice. They lose their teeth. And if it's done correctly, if it's done very methodically, and then the implants go in correctly and methodically with proper surgical technique, and then the same thing with the prosthesis, if it's done correctly and methodically, the end result is beautiful, and there's really no way to put a price tag on it. It's something that will last them the rest of their life, and if it's maintained and they support it, it'll be such a great investment. And we have our forum here where you can ask questions, you can ask, discreetly in a direct message about your case specifically. If you want to send x-rays, we're happy to look at those. Even if another doctor is working on your case and is maybe struggling with the prosthetic side of things, we can help guide them along. So this is, it's a wonderful process. I hope that our viewers are getting something out of this. And again, if you have suggestions, please give them to us, and we will make any changes or talk about subjects that you're interested in. So I'm Dr. Willardsen. I'm here with Memo Hea, and we are here to support the implant market and the implant world and those patients who are in need of dental implants and are in need of a smile reconstruction. And so hit that like button, subscribe, and continue following us every Wednesday. Sometimes we do get started a little bit late, but you can always watch the video, and we try to go for about an hour. And as the channel grows, we may add another day, so we may do 1 or 2 days of vlogging and of live streaming, because it is important. This is an important subject, and especially for those patients who are in need of these processes. So I'm Dr. Willardsen, and thank you for watching. And again, hit that like and subscribe button, and we'll see you next Wednesday at 9 a.m.